But if that's not bad enough, a new rule proposed by Health and Human Services could give the government access to your medical records as well, your personal information. For more on this, we turn to Fox News legal analyst Peter Johnson Jr. Good morning.
Hi.
So this is not specifically part of Obamacare, but now it's a rule being proposed.
It's a regulation proposed by Secretary Sebelius that says, under one way or the other, the federal government is going to have access to each and every doctor visit, every part of your medical record, every part of your medical history, in order to so-called stabilize premiums. They're saying, well, we're going to be insuring everyone, so we want to know that people are being charged properly, that they're not being ripped off because of the new risk in the system. And based on that excuse, they're saying, well, we're going to need everyone's records. Either the state will give them to us, or you will give them, insurers, directly to the federal government. One way or the other, we're going to get Americans' health records.
Even if you continue with your current provider, even if you don't opt into the government-run program?
It appears so, and it appears part of this kind of octopus-like control of health care that I talked about for a year. You know, a lot of folks on the Democratic side who were very supportive of Obamacare said, you know, when you find out what's in this health care proposal and now this law, you will really like it. But now we know in like a 25 or 30-page regulation that the Department of Health and Human Services has put out, and if you want to comment on it, you can go to regulation.gov and tell the government what you're really thinking. They're saying, well, because of stabilizing premiums, because of making sure that people aren't being charged too much, we have a need now to see each and every record. So some congresspeople are saying, well, is this going to lead to some Orwellian kind of state where the government is looking at really the last vestige of privacy in this country is how you're feeling and what your medical history is.
So legally, can they do that, number one? Number two, what kind of legal problems do you have with it?
Oh, I think that legally they believe they can do it. There's something called HIPAA in this country that a lot of people are aware of, whereby your health records are protected. But under certain situations, you give up those rights in order to get benefits, in order to get care, in order to share information. And there's a tremendous amount of sharing of information that already goes on with regard to our health records in this country. But what this regulation will do, and we don't know all the ramifications of it yet, I'm going to continue to look at it, will for the first time mandate that all of this critical private health care information of yours and mine is available and in the possession of the government. And God forbid if we have a WikiLeaks. Do you want to wake up some morning, you know, Joe American or Jane American, and read about your health care on the internet? It's a little bit disturbing.
Fascinating question. Always great to see you, Peter Johnson. Continue to look at that, and we'll have you back to discuss it further. Well, you know the feeling you get on a Friday? TGIF every